Hey guys, now we're going to describe the second part of the peripheral nervous system. We already described the somatic division. Now we're going to describe the visceral division, which is also called the autonomic nervous system. Does it look familiar to you? We have brought the same slide because I want to let you know that everything is a pattern, or maybe we change some things but the pattern is the same. It's the same flow of information, the same direction. Okay, so we said when we were describing the somatic nervous system, we said that we have receptors that detect the stimulus, right? They're in the periphery, and they can be, in the case of somatic receptors, they can be either free nerve endings or encapsulated receptors. Good thing is that here in the autonomic nervous system, all of them are free nerve ending kind of receptors. Now, those receptors send information to the integration center, and the integration center sends a motor command after processing that information to a target organ, which only receives the motor command to contract. That's it. Now, this integration center consists, remember, of the central nervous system, the brain, and the spinal cord. Now, the spinal nerves, or the nerves coming out from the brain, are cranial nerves, and the brains coming out of the spinal cord are the spinal nerves. And they both form the peripheral nervous system. Now, the peripheral nervous system has two branches, the sensory and the motor. Remember, the sensory or afferent division, which brings information from the receptors. These fibers are connected with the receptors, or are the sensory neurons, and that's it. So they bring these sensations or this sensory information to the to the central nervous system. The other branch of the peripheral nervous system is the motor or efferent division, the executive branch. Remember, the one that dictates to the target organ what they're going to do. They're going to contract and or not, or they're going to stimulate a gland to secrete. Now, remember we said that the body has like two, or is organized in two parts, the somatic and the visceral. The somatic is what we described previously, the skin, the skeletal muscles, joints, tendons, and the visceral are all the internal organs that contain either smooth muscle or cardiac muscle tissue, and included in there are the glands. Okay, in the first part of peripheral nervous system, when we were describing the somatic division, we described everything that is shaded, all the somatic receptors, the general somatic receptors. Okay, today we're going to describe the general visceral receptors. And these visceral receptors are widespread, scattered all over our visceral organs. This is one of the reasons why it's so hard for us, or so difficult to us, to precisely say I have, or my pancreas is hurting, or my stomach is hurting, or now I can feel that my gallbladder is hurting, because these receptors are widespread and we cannot pinpoint the pain to an individual visceral organ. Okay, so those receptors are in these organs. Remember, urinary bladder, in the heart, the blood vessels, respiratory airways, small intestine, glands, etc. Well, not glands. Now, what are these receptors detecting? Almost the same things, almost, except of course touch. But they can detect pain. We have nociceptors on the viscera, on the visual organs, except the lungs and the brain. They have no pain receptors. You can poke the lung, you can poke the brain while you're asleep and you won't feel anything. Quick example, when you're inserting, when we're inserting a chest tube, okay, because we need to re-inflate a collapsed lung, we put anesthesia just there in your skin and deep enough just to reach the muscles in here, the intercostal muscles, maybe the serratus, and the parietal pleura of the lung. That's it. Then you go with, I don't know if you have seen those tubes or thicker than this. If that is under anesthesia, that's it. The patient won't feel anything. You pass through those somatic layers that are numb, no pain in there, and then you can poke with the tube, and actually you probably will, the lung, or and the patient won't feel anything. Uh, Biopsies, when you're doing a endoscopy, and um, and you want to grab a piece of tissue, a piece of stomach to examine for cancer, or hysteroscopy during in your GYN, and then you're going to grab a sample of uterus. Those procedures are done without anesthesia, um, and patients feel no or little pain, little discomfort in the area, because these pain receptors don't act as the somatic pain receptors. They react to stimulus like irritation, inflammation, smooth muscle contractions or spasms. So that's when you feel your cramps. Uh, those are the stimulus that can activate a pain receptor or nociceptor in the visceral organs. Uh, Other sensations that can be felt in there is temperature, stretching, very important, like in the urinary bladder, like the blood vessels have some baroreceptors, and they stretch depending of, let's say, in the carotid artery, there is a receptor for pressure, and when the blood pressure is too high, they are stretched, right? The force of the flow of blood is so strong, and so maybe so much blood also increased volume that it distends or stretches the blood vessel, and that signals the central nervous system. Chemical changes, irritation, all of these sensations are the ones being detected by the receptors, and they are sent to the central nervous system using sensory or afferent fibers, and the brain integrates that and interprets those sensations as pain, nausea, hunger, fullness, etc. Here in the brain, this sensory information arrives. Let's remember a little bit from the previous chapter. The sensory fibers arrived at the dorsal root ganglia, and here in the ganglia is where the body of these sensory neurons are. Remember, the receptors in here are only the free. Let me see if I can. Okay, right in here we have the sensory. In the sensory root ganglia, we have the body of the sensory neuron, okay, and is receiving these sensory fibers, and these sensory fibers, the end of these sensory fibers are only the free nerve endings, and these are the ones acting as the receptors. So the free nerve endings of these sensory neurons act as the receptor, detecting these stimuli. Using these fibers, sensory afferent fibers, or gets to the sensory root ganglia located on either side of the spinal cord, but also the ganglia. Remember that we described some ganglia located on the cranium. They are associated with cranial nerves. So that sensory information arrives to those ganglia. Then these axon gets inside the spinal cord, now inside the central nervous system, through the dorsal roots, okay, through the posterior horn of the spinal cord. Following me? In okay, so it reaches this area in the dorsal root of the posterior great horn of the spinal cord. From there, this information ascends through the spinal cord and reaches the thalamus. Remember, here in the thalamus is, or every sensory information needs to reach the thalamus. And if the thalamus consider is important enough for the brain to know, or for us to make it conscious, well, it will deliver that to the cortex. Now, the cortex in here specifically is located on the insula. Remember, the insula is the lobe located deep into the lateral sulcus between the temporal and the parietal lobe. There is where the visceral sensory cortex is located. Okay, so that's the sensory pathway, or how these sensory information gets to sensory visceral information gets to the central nervous system. Then we have the executive branch. Okay, we have a motor command that is going to be elaborated, created by the central nervous system based on this stimulus. Okay, and this response is going to travel out the spinal cord from the thoracic segments, okay, of the spinal cord. And remember that in the somatic division of the peripheral nervous system, this motor neuron was located on the anterior great horn of the spinal cord. In here, in the the visceral division, or visceral motor division, autonomic nervous system, is located in the lateral great horn that is only present on the thoracic segment of the spinal cord. Okay, and this motor neuron is a motor neuron. We will see what it's going to do. Okay, it's going to reach hopefully a target organ, but we will see what will happen before it reaches the target organ. Okay, so just to review one more time in here, remember that the motor, let me hide this. Okay, the motor or efferent division has the visceral motor division of the peripheral nervous system, which is the autonomic nervous system, and it has the somatic, it's not there, the somatic division, which consists of, or innervates the, let me put it all in here, innervates the muscles. So we described in the last chapter the somatic division of the peripheral nervous system that innervates skeletal muscles that are under our conscious or voluntary control. Today, we're going to explain the other branch, the visceral motor division of the peripheral nervous system that controls the cardiac muscle tissue, the smooth muscle tissue, and the glands, the secretion by glands. Remember, these contractions are not under our voluntary control, so we call them the involuntary nervous system. And we have two divisions that we will describe in a little while, which are the sympathetic and the parasympathetic divisions. Few concepts that I want you to have clear before moving on into the comparison. Oh, I had it. Okay, into the comparison of the two, the somatic and the visceral nervous system, is to have clear synapses. Remember, it's a place where two neurons communicate. Okay, the first neuron is the presynaptic neuron, the one before the synapse, and the second neuron is the postsynaptic neuron. And where they communicate, we call that a synapse or synapses. Ganglia, remember, a group of cell bodies on the peripheral nervous system. On the central nervous system, we call them nucleus. Now we are in the peripheral nervous system, everything is going to be ganglia. And the axons of these ganglia, of these neurons located on the ganglia, the axons or fibers are also called, they group together into nerves. So we're going to use axons, fibers, and nerves as synonyms, okay? So I hope we are oriented and ready to explain the autonomic nervous system. We are not going into too much detail. We're going to explain only, we're going to do an overview of both systems. But if these concepts are not clear, please review them, go back to the previous chapter, or replay this video. See you in the next one.